working with medical education and curriculum, because when you all start medical school, you'll see how important the design of the curriculum is to engage you as future doctors. So I have the privilege of introducing Adan. So Adan is a rising fourth-year student at UC Berkeley who is an ethnic studies major. He comes from the Sacramento area. He's the oldest in his family with an 8-year-old sister. He's also co-founder of a student-run organization over the years that he's been at Berkeley that tutors Spanish-speaking janitors in ESL called Puente, or Bridge in English. And I had the privilege of meeting each of our students for individual mentoring during these 2 months. And this was very impressive because when you do an activity as a student, following through and not just having an idea, implementing it, and then just leaving it, this is really key to change. So, Adan, we're looking forward to hearing your presentation.
Thank you, Dr. Roberts. Good, very good. So, welcome to instead of IMAX, it's URI Max. So, my feature presentation is Analyzing Becoming the Patient module. So, for my presentation, here's my outline. So, as you know, in the movies, we all have the previews. That's sometimes unimportant, but it's really important to me. So the first preview is of the clinical experience, and then the feature presentation is about my research project that I did over the summer, which is Analyzing Becoming the Patient module, 2012 edition, and then the epilogue, which is the research question from the online course that all the URI students participated in. So my clinical experience, each and every one of us were able to shadow in labor and delivery, a few of us in the neighborhood health clinic, other people in different departments in OB-GYN in either Richmond, in Kaiser, SF General, or here at UCSF. I was able, like Bryant said, to go with my faculty mentor, Dr. Amin Azam, to the Langley Porter Psychiatry Center, and then with Dr. Hobart Harris with his post-op clinic. But the most significant one for me was actually the Neighborhood Health Center with Dr. Kobashi, because just a sense of empowerment in a clinical setting, and his interaction with the patients, and even before the clinic started, all the physicians and everyone involved in the clinic had a meeting and sat down and talked about their patients that they were going to see that day. And just to see that community in a clinical setting really showed me, like, it could be a family. Like, in medicine, it's a family. So, like, it's a family-oriented job. And that's what's really making me excited to get into medicine. So now, the feature presentation, Analyzing Becoming the Patient. And I am a part of ARG, or the Azam Research Group. That's our little mascot. Go Bears. And so with my project, Becoming the Patient, it's actually part of the first year Foundations of Patient Care. But what exactly is the Foundations of Patient Care? It's actually a longitudinal 18-month course that runs in parallel to the other medical knowledge focus courses. So every medical school has a foundation of patient care, but it's not called that. It's either called a Doctor 101 or how to use a stethoscope. And yeah, so, and it's broken up into 5 different settings. It's lectures, small groups, preceptorships, problem-based learnings, sessions, and integrated exercises. And the Becoming the Patient module is actually part of the small groups setting. And this is actually the data that I analyzed. This year was the 2012 edition, and this is the second time that it was taught. So the similarity between the first and second year is that it's a 2-hour curricular model. There's a time for introduction of the topic, personal reflection, 5 video interviews that span about 25 minutes, and a discussion time in a small group setting. And after the curricular model was done, the medical students took a survey that had 12 Likert items. But the difference was that in 2012 survey, we added 3 open-ended questions. And the first year, it was a consolidated 2-hour curricular model. While in the second year, in 2012, it was a split session. So there was 1 hour split and 1 hour, 2 1-hour increments. And after the session, students were, or for the split session, excuse me, the students were required to watch videos at home, which could pose a problem. So now comparing the data. Okay, oh, sorry. There we go. So, oh no. There we go. Okay, so becoming the patient evaluation data. So as you can see here with the first line here, locate articles and resources available for professionals with illness or disabilities in 2012 and in 2011. This question is very significant, and medical students feel, there's a widespread of sentiment with this question, and for two consecutive years. Well, the rest of the data is pretty much a similar spread of data. And the third one, oh my goodness, there we go. So again, a similar spread of data, and yeah. So now for the additional questions. How did the split session impact your experience of the becoming the patient content? So there was 15 students that said that they did not like the split session or wanted just one single session, and 11 students reported that it was fine, no complaints. And what did the faculty think? One faculty member said it was negatively impacted, so he would recommend one session. And the other faculty member said that the interval was too long, that students forgot about what they were talking about in the first session. And then what did the students think? Okay, but this graph pretty much shows why, or if it was consolidated or split session, and 49 students thought it should be consolidated. And what did the faculty think? They also agreed with the medical students that they would recommend that the session should not be split and it should be consolidated, and again, consolidated. And here are additional quotes from medical students. Some thought it should be shorter interviews. Videos were too long, and they would like more of a structure of an FPC lecture. And one student thought it really rocked, apparently. Okay, so conclusions. So for both the 2011 and 2012 surveys, all 12 Likert items had a similar majority positive responses, which suggests that the curricular model is effective overall. And for 2 consecutive years, medical students did not feel competent in their abilities to locate articles and resources available for professionals with their illness or disability. So for our future direction, we're going to incorporate a discussion of resources to fulfill the need up here, and to keep it a 2-hour consolidated session. So that's the end of my big portion. Now for my epilogue for my research question. And my research question just kind of came up from just my clinical shadowings and just looking at how to administer surveys with Dr. Amin's research. So, and my question is, how does alternative forms of medicine affect mental health? And my hypothesis is, if Latinos practice alternative forms of medicine, they will have better health outcomes. And the importance also came with one of Dr. Guerra's didactic sessions, where he said that alternative forms of medicine are important to the Latino community, whether it be in form of prayer or meditation. And this is especially important for me because just yesterday, one of my cousin's wife just passed away because she was battling pancreatic cancer. And in the Latino community that I come from, we have a very strong faith-based community. So while she was in the hospital, there was a lot of prayer. You could see a lot of prayer, and just me being objectively, you could see how prayer influenced the mental health of my cousins and also his children, because when the doctors came into the room, they saw that there was just a piece about my family members that was unexplainable to different physicians. So I want to explore mental health and alternative forms of medicine even more. Thank you very much to my executive producer, Adan, my production crew, the production company, URI, with Dr. Juan Guerra and Patty Robertson, and my director's assistants, and here's some of our research group. Thank you very much.